Okay, let's continue. So let's do blood flow it's a blood flow to the upper limbs. Okay, so the upper limbs here, subclavians on both sides do the same exact thing. They both go to your upper limbs. So let's follow one on this side, but it happens on both sides. So here your subclavian will form in the area of the armpit, forms your axillary. So let's call that number 21. It's the axillary artery here. And then it runs down the arm as your brachial artery, 22. And at the elbow, it separates, like so. So here's the elbow, okay? So at the elbow, it forms your 23 radial artery and 24 ulnar artery. So it runs along the radius bone and the ulnar bone, then it goes over into the wrist area, close to the palm, to form what's called your palmar arch, 25, before running along your metacarpals and digitals as your 5 digital arteries. Okay, so let's number those. So 21 is your axillary artery, blood flow to the axilla, right? 22 continues as the brachial artery, run through the arm, along the brachium, so the brachial artery. And at the elbow, it splits into 23, your radial artery, and 24, the ulnar artery. Okay. Then here becomes your palmar arch. And then the fingers and metacarpals, same vessel comes along this way, and they form your digital arteries. So that's the upper limb, okay? Let's go over here and let's do the abdominal cavity while we're here. So your abdominal cavity, once the aorta pierces the diaphragm, this is your diaphragm, comes to the diaphragm, right? It right away forms a vessel that has 3 parts to it, okay? So this vessel here, at this point, that vessel is called your celiac trunk. It's called 27. Okay. I don't know if you can see it clearly. So this vessel right here is your celiac trunk, and it has 3 branches to it, okay? Called A, B, C. Okay, which are your left gastric artery to the stomach, your splenic artery to the spleen, and your common hepatic artery to your liver. Okay, and we'll write that down shortly. So 27 here is called your celiac trunk, which has 3 branches. The left gastric artery to the stomach, B, your splenic artery to the spleen, splenic artery, and C would be to your liver, called the common hepatic artery. Okay. Then you have a singular vessel that comes off, called a 28. Okay. That's called your superior mesenteric artery. It carries blood to your small intestine. Superior mesenteric artery, blood to small intestine. And then you have a double vessel, one to both sides, here to your kidneys. Okay, so it's a blood flow, so the vessel that carries blood to your kidneys, we can call that here, that's number 29. Okay, that vessel is called your renal artery. Renal artery. I have a better kidney there, by the way. This is better. Okay, kidneys there. And then you have 2 vessels like this. called the number 30. Number 30 carries blood to your gonads, to your ovaries or to your testes. So we call your gonadal artery. Okay. And then you have one more singular artery off there, called 31, carries blood to your large intestine. Okay, that's called your, this one's 31. Okay. That's called your inferior mesenteric artery, which carries blood again to your large intestine. And then the aorta finally ends right here. Right where it ends, called 32, that's called the common iliac artery. That's where the aorta ends. And then you start to have blood flow down to your lower limb. So 32 is your common iliac arteries. And we'll do that next. Let's pause.